had someone ask me once what it was like to be a mother of triplets. My answer was, like, being a mother is hard. It's really hard to be a mom. Being a mom of triplets is, even harder. And being a mom of triplets with chronic illnesses, no one should have to do that.
Pediatric autoimmune diseases are rather common. There are more than 100 autoimmune diseases have been described in the literature, affecting 40 million people in the United States alone. Unfortunately, most of these patients are either pediatric patients or women.
Cameron sort of got all the diseases first. So she got myasthenia gravis at 18 months, and then at 5 years old, she was diagnosed with type 1 diabetes, and then she was diagnosed with thyroid disorder, and then she was diagnosed with autonomic dysfunction. She has been the sickest of the three.
When I was in 8th grade, I wasn't going to school, and I thought that my life was over. I would just sit in bed all day, and I had no friends except for Peyton. And I wouldn't socialize, I wouldn't leave the house, I wouldn't do anything. And I was like, is my life gonna be like this for the rest of my life?
When you're pregnant, you have your maternity bag right by the door. I had a hospital bag. I was just always ready to go, on high alert.
When your kids are suffering, you suffer. So we all had to, kind of work together, and lots of hard days and hard nights and years upon years of trials and tribulations.
Normally, we live in harmony with our cells in our body. Unfortunately, when you have autoimmune disease, you make antibodies against normal bacterial flora living in your gut. That's not normal. You need to give the patient immunosuppressive therapy to suppress his ability to reject itself. But the problem is, you can't just give it to them for a month, just like when you treat pneumonia, for example. Unfortunately, that's not the case. Here, you're going to give them treatment for the rest of their lives.
Jack was misdiagnosed with asthma for 10 years. About 2 years old, he started having some breathing issues. It just wasn't getting any better no matter what we did. He did scopes, he did shots, he did absolutely everything we asked of him, and he just couldn't breathe.
I have this thing called eosinophilic esophagitis, EOE for short. Basically, if I eat foods, certain foods flare up my eosinophils. If I eat a lot of the certain foods, my esophagus just flares up, kind of like my esophagus is allergic to the food.
We changed his diet, and he hasn't been to the hospital since.
So epigenetic factors plays a major role in the induction of a disease. If you do something, diet and lifestyle, it will change the function of the gene, but not the structure of his genes. So the essence is we need to modify these epigenetic factors. And the epigenetic factor is mostly diet and lifestyle.
Of the three growing up, Peyton was the healthiest.
Peyton ended up getting all the same diseases, but at least we'd had a lot of experience, and then they had someone to kind of share the experience with.
I got diabetes. That's definitely a disease that I deal with every single day. I make a lot of life changes, eating habits, exercise, everything is different because of diabetes.
With them being sick for so long, it makes you appreciate when things are good. Parents know having one kid is hard, 3 kids is a lot harder. Then you throw in all of their different, immune diseases and such. It's been a hard road, but when they come out the other side and they're in a good place and are on the path that you hope that they would be going into, it's fulfilling.
We're happy, and they're healthy, and that's really all we could ask for.